in the workers' compensation process. We have had multiple meetings with various groups, including the AFL, the legal community, the Medical Society, Hospital Association, and all the business groups. I want to thank the Chairman of the Judiciary Committee, Representative Nekritz. I want to thank Speaker Madigan, Leader Cross, Representative Brady. I want to thank Representative Kaye for his leadership. And I also want to especially thank Director Mike McGrath from the Department of Insurance and my dear friend, Senator Kwame Raoul, for his leadership on this issue. Senate Amendments 3 and 5 to House Bill 1698 involve several different aspects of reform. And I would say that it's a combination of medical fee reduction, indemnification reform, system reform, and insurance reform, where everybody bears part of the burden of the reforming of the system. The Director of Insurance has indicated that he believes that the overall savings on this is anywhere from $500 to $700 million as a conservative estimate. Let me repeat that. The estimated savings on this conservatively are between $500 and $700 million. There are some aspects of the bill that are harder to empirically quantify in terms of savings. The first issue, the medical fee schedule. The state of Illinois' fee schedule is 180% above Medicare. It is the second highest fee schedule in the United States, the highest being Alaska, which is not a good comparison because Alaska is different, obviously, than the contiguous 48 states. 180% above Medicare. The next closest state is Delaware at 131%. To go from second to third highest fee schedule, we would have to reduce the schedule by over 50%. The proposal is to reduce the fee schedule from 180 to 150, or 30%. It would still be 150% above Medicare private insurance costs. We would shrink the GeoZips from 29 to 14 and 4, 14 for the hospitals, 4 for the doctors, which is based on Medicare GeoZip standards. One of the major indemnification reforms is the reduction of wage differential. This was a significant concession by the employee groups. It would reduce the wage differential from being based on life expectancy to being based on work expectancy. We would go to a PPO program where employees would be able to retain their choice of physicians, but where the employer community would have the opportunity to have some level of direction of care. The utilization review is harder to empirically quantify, but it would basically give the employers more opportunity to contest unnecessary medical procedures or unnecessary medical bills. And in conjunction with the PPO, the choice of physicians through the PPO, although a difficult savings to calculate, empirically provides significant cost savings. Intoxication. The intoxication defense, for the first time in the history of Illinois, would be available to employers who are dealing with workers who are injured as a result of their own intoxication. One of the most significant indemnifications or legal reforms that's included in this bill is the inclusion of AMA guidelines. Let me be clear. AMA guidelines have never appeared in the Illinois Workers' Compensation Act. They've never been a part of discussions. They've never been involved in the rating of disability or the rating of impairment. Under this provision, arbitrators are required to consider the AMA guidelines in evaluating workers' compensation claims. We're limiting the carpal tunnel awards. We're putting a cap on carpal tunnel awards in response to the situation that took place at the Menard Prison. We're creating a collectively bargained workers' compensation pilot program for 2 internationals within the state of Illinois to see whether or not collective bargaining within the workers' compensation is something appropriate for our state. We have codified the standard of compensability, which states that an employee bears the burden of showing that he or she has sustained accidental injuries arising out of and in the course of employment. One of the most important reforms in this legislation is the immediate recalculation of insurance rates. This will require the national agency, which sets the insurance rates, by September of this year to recalculate rates so that the 15 to 20% rate premium reduction that we anticipate and calculate would be realized as soon as possible to employers within the state of Illinois. There are significant commission reforms. We are firing the arbitrators. We are requiring them to be lawyers. We are putting them on 3-year terms. We are rotating them in and out of areas. We are requiring them to abide by the Judicial Code of Conduct. We are beefing up the fraud unit. We are giving the Department of Insurance greater ability to handle the state's own workers' compensation issues. We are allowing for additional hardware. We are allowing additional penalties for noncompliance with insurance issues, the ability for electronic billing, which has been supported by the medical community, and some other less major issues. Ladies and gentlemen, this is a significant reform bill. It's the most significant reform bill in workers' comp that we've seen in our lifetime and probably ever will. It passed out of the Senate overwhelmingly with 46 votes. I would ask you to consider this as an opportunity to save businesses hundreds of millions of dollars in actual money realized in the comp system and double-digit premium percentage savings on their premiums and on their workers' comp insurance on a day-to-day, month-to-month, yearly basis. Ladies and gentlemen, I would ask for an aye vote.